Hey everybody, welcome. I am Wendy Robbins, producer, director of The Marijuana Show, seen on Amazon Prime by millions, which is cool. It's kind of like Shark Tank for the cannabis industry. And my partner Karen, Paul, and I decided we'd create Bud Camp. And Bud Camp is essentially like Mentor Box for the cannabis industry. We talk with industry experts on health, wealth, all of it. And so today I'm really excited because I have Brianna Cardenas on. That took a second for me to get that right. Hi, Brianna.
Hello. Hi, thanks for having me.
Yeah, absolutely. So as everybody knows, we get to this really, really fast. And the first question I have for you, Brianna, is as a healthcare provider, why do you choose cannabis over pharmaceuticals?
For me or for my patients?
For your patients.
For my patients. So I do kind of a combination of both. But in light of the opioid crisis, since I do still work in chronic pain management in a traditional setting, we do still employ traditional pharmaceuticals at times. However, a lot of them have a lot of side effects. And as people age, baby boomer population, we start to see a lot of negative effects from all of these different medicines combined. So the nice thing about cannabis is that it offers, in my opinion, a safer alternative than opioids, as opioids can literally kill you if they're not taken appropriately. And it can also facilitate healing, so true anti-inflammatory and pain relief rather than just masking pain.
Yeah, I totally agree with you. I mean, CBD for inflammation to me is brilliant and to create balance in the body. So next is, can cannabis actually heal people?
I think so. I mean, I feel like I'm a living testament to it. I have a chronic illness myself, and I've also seen it benefit quite a few of my patients. So the recent research shows that cannabis works on several different neurotransmitters in the brain, including indirectly dopamine and serotonin, which are some of our happy chemicals, our reward chemicals, and that are associated with motivation and activity levels. So cannabis can actually help get us in a better mindset by truly helping to upregulate some of those chemicals that have antidepressant and anti-anxiety effects. So patients immediately start seeing less suffering as a result of chronic pain, because it affects everything. It's it causes changes in our minds, changes in our bodies. And so the nice thing about cannabis is with its anti-inflammatory properties, depressant properties, and all of the different combinations together, people can actually start seeing remission of some symptoms with either Crohn's disease, chronic pain, arthritis. All different types of conditions can, in my opinion, and from what I've seen clinically, can really help benefit a lot of people.
Yeah, I agree with you for sure. And, look, the United States government has a patent and actually just let GW Pharma, which is an English company, it got FDA approved for CBD or cannabidiol. So yeah, we're totally aware of it, and yet it's Schedule 1, meaning that there is no medical benefit, which of course
right.
is just complete BS. But all right, so let's talk about what I'm throwing around acronyms as you have CBD, but tell us what CBD is and what is THC and what's the difference?
So CBD is cannabidiol, and THC is the more psychoactive component. So CBD can provide more of an anti-inflammatory and non-psychoactive or no mind high type of effect for the body, but it also can provide some anti-inflammatory and general pain relieving effects. We have cannabidiol receptors in our brain and spinal cord, which both THC and CBD bind to, and they help to produce that pain relieving property, especially for nerve pain, and also some of those mood enhancing effects that we discussed earlier. So CBD is available online, so you can actually buy it like on Amazon or on multiple different sources, and typically does not require a medical card. So it's something that people in all 50 states can pretty easily access and try and see if it's something that benefits them. What we've seen from research is that typically when we combine CBD and THC and the terpenes and all of the multiple chemicals from the whole plant product, that patients tend to get a little bit better relief, because they call it the entourage effect, where all of the different chemicals of the plant work together to produce a better synergistic effect for pain relief. THC has a couple different strain types or classes. It has indicas, sativas, and hybrids. And so the combination of those in combination with CBD can really help to alleviate different forms of suffering, And that's why I think it's important that if patients are going to use medical marijuana, that even in legal states, it's a good idea to talk with their healthcare professional or someone who is educated on the uses of cannabis. Because when people start, I hate to see someone have an adverse effect because they just went out and bought, a gram of something that they've never tried and it might not be the strain for them. So talking with somebody who's knowledgeable about cannabis in advance can really help steer a person into what combination or which therapeutic agent might be best for them.
Yeah, I totally agree. There's people that say things like, well, that didn't work for me, or it made me really paranoid. To me, that just means the brain wasn't quite right, that they were choosing something. Too much of a sativa might feel paranoid. So like anything, you've got to adjust and really talk with people and ask them a variety of questions to make sure. And if you're feeling too angst ridden, typically that's a sativa. And so you might want more of a hybrid. And
absolutely.
Yeah, totally agreed. So next question, what is the difference between sativa and indica? You sort of talked about that and what's best for my symptoms. If you can go into more details, particularly if somebody were to go in and go talk to a bud tender. And if you're new to cannabis, a bud tender would be the person that is able to sell you a variety of different strains. And so the more information you have, particularly if they're not very well versed in cannabis, though they should be, some are not well trained, you want to go knowing knowing how to speak. So let's go.
Right. So we have sativas, indicas. The way that I remember it and that I touch. So it basically is something that will tend to produce more of a body sensation, more relief. However, it does produce a more sleepy effect, a more heavy effect, as some people call it. So that one's really better for people who have insomnia or people with pain. That tends to just be that deep aching pain that doesn't go away. Sativa actually can help with a lot of more of the neuropathic pain component and also has more of an uplifting effect. So sativa is one that will be more of a daytime strain that someone can use throughout the day without a lot of those sedative effects. And for people who are suffering from depression, sativa can be a really good option because it can give you that uplifting and that extra motivation that you need to kind of get through your day and accomplish some of the tasks that you need to accomplish. Kind of the downside of some sativas, like you mentioned earlier, is that it can predispose people to, or who already are predisposed to anxiety, it can kind of worsen or enhance those symptoms. So if someone's looking for the benefits of the sativa, with the antidepressant effects and the neuropathic pain effects, a hybrid's probably a better choice for them because they can get it a little bit, leveled out, if you will, with the indica cross, and that's what makes it a hybrid. The other strains that I really highly recommend for people is high CBD strains. So there's a couple different strains like Cannatonic and Harley Sue, and a couple of different ones that are very high in CBD, but have a lower THC content overall. So they don't tend to produce quite such a psychoactive effect. So people can use that in a little bit higher dose, or maybe have, 1 or 2 hits of their vape or sprays of a sublingual, and get a little bit better relief of the pain, but still be able to function at work and get through their day without so many psychoactive effects.
Yeah, I use it daily, definitely. So the next question, and because I'm hearing background, can you turn your mic down a little bit? The sound?
Sure thing.
Okay.
Let's go over here.
Hopefully that'll help. Like it's helped already. So that's good. Okay. Next question is, how should a patient approach their doctor about starting to use cannabis?
Is that a little bit better on the mic?
Yeah.
Sound there.
Perfect.
Okay.
Thank you.
Perfect.
Yeah, so how should a patient address a doctor who may not be cannabis friendly?
Right. So that's kind of hard to say because sometimes people come to our clinic and they don't assume that we're cannabis friendly. So they will kind of dance around it, or they'll, be concerned because a lot of the, there's a lot of scrutiny right now in pain management with the DEA and the opioid crisis. So it's kind of a touchy subject. I would say that patients are typically going to have a better result if they're going to a state that already has legalized cannabis recreationally. I practice in California, so since it's legal, the way that my boss and I kind of look at it is patients are going to try this anyways. And I would rather be able to educate my patients on the appropriate uses of cannabis, the appropriate strains to start with, etc. So I like to suggest to patients to bring up the actual DEA and the FDA guidelines for chronic pain, which say that THC should not be something that's drug tested for in pain clinics. Because the position statement from some of the national organizations like the AAPA and the American Academy of Family Practice don't have a negative necessarily position statement on cannabis. So what I'd like to suggest to patients is to just ask the question of their doctor, do you think that I have a condition that might be beneficial or might benefit from the use of CBD? I start with CBD because it's a more toe in the water kind of way for especially some of the older physicians to maybe digest the idea of their patients using cannabis. But I think that it's a good idea to seek out a medical recommendation from someone who's certified in recommending cannabis, and perhaps bring that recommendation to their family physician and say, hey, I've already consulted with the physician. They've recommended these for these reasons. Do you agree? And ultimately, the way that I see it is our job as healthcare providers is to make sure that we're alleviating the suffering of our patients, and do no harm is our first role. And I sincerely feel that lower harm of medication in a lot of the pharmaceuticals that are out there. And so patients can, I'm trying to reduce my pain medication use, and trying to reduce the amount of pharmaceuticals that I'm using. Do you think that cannabis can be a way that I can accomplish this? And just sincerely starting with the asking of the question, and that can kind of let the patient gauge, hey, is this doctor going to be totally anti-cannabis and not want anything to do with it? Or is the doctor going to be open-minded, or even perhaps maybe somewhere in the middle and refer to a specialist that would be okay with considering the patient and managing the patient with cannabis?
Yeah, and as a patient, you have to right. So, you know.
You do. It's so important to have a good relationship, because if you go somewhere and you don't feel like the person is listening to you, that you can trust them, or that they sincerely have your best interest in mind, that's probably not the healthcare provider for you.
Completely. I agree. So next thing is, can cannabis help solve our opioid epidemic?
I think it can certainly play a big role in that. So this is a situation where 50,000 people a year are dying. And we typically see that from illicit use. But on the other hand, we see chronic pain patients who use their medications responsibly and as prescribed, having increasingly limited access to these medications as a result. So it's kind of an unintended consequence of the illicit use of opioids and the subsequent overdoses. But I think ultimately, when we're talking about the population that is the addict population and people who are using intravenous drugs or abusing medications not as prescribed, those are patients who are at certainly high risk for adverse events, including death. So the number one scenario, in my opinion, is harm reduction. So even though some people say, well, you're just, substituting one addiction for another, if you were to take someone, for example, who uses intravenous heroin and hand them cannabis, I'd be hard pressed to find a colleague or someone with addiction training that would say, oh, they're the same. It's a harm reduction strategy. So first, we want to make sure people aren't dying. And there's never been any deaths from cannabis. So ultimately, we need to look at this not so much from like a moral issue like we have going on at our national and federal level as far as drug policy goes. We need to make sure that patients have not only access to something that is potentially going to stop them from dying unintendedly, but also physicians and people like me in healthcare need to be able to have access to research to be able to help people. There's a couple of great organizations. One's called Helping End the Opioid Epidemic in Colorado. I've connected with some of their members on LinkedIn, and they're actually working to promote cannabis in the healthcare industry, and also providing guidelines and step therapy to help patients actually taper off of opioids and into using cannabis. So I think it can help in multiple levels, from a life-saving harm reduction strategy when we're talking about patients who are using drugs illicitly, and then also from a pain management standpoint where patients are having difficulty accessing their drugs. or accessing their prescriptions rather, having access to cannabis might be something that allows them to have a better quality of life without so many pharmacies.
Agreed. So we've already talked about chronic pain and how people are using it. You've got 100 million people dealing with chronic pain. It's a lot of people, and I agree with you. Cannabis has no overdoses, no side effects, unless there's pesticides in there. And so obviously you want to go and you want to double check or see if there's a lab test for the cannabis that you're going to be using to make sure really that it's really clean. There's not mold or, mildews or things like that. So we talked about how patients can use cannabis without getting high, meaning CBD use essentially, as opposed to THC. And so let's talk about, what dose or strength somebody should start with if they're just starting with cannabis, because if it's somebody that's 50 years old and they used it when they were in their 20s, they're going to be really shocked at how potent cannabis is now compared to, when they were a kid.
Discussing cannabis with patients. There's a couple of different resources out there right now. One is on healer.com, and it's guidelines written by a physician on titrating or introducing to cannabis. There's no standardized federal guidelines, and everybody's tolerance is a little bit different. So the adage in medicine that we use is start low and go slow. So according to the healer.com reference for patients and physicians, they recommend starting with 1 milligram of CBD or THC or a combo of both. So 1 and 1 milligram, starting and titrating by 1 milligram each day. So starting at 1 milligram on day 1, then if there's no side effects or adverse effects noted, then next day you can go to 2 milligrams and so forth. That's if you're doing like a tincture or you're doing some type of ingestible form of cannabis. However, there's a lot of different forms like topicals. So this is one of the ones that I use by Soothing, which is like a lab tested company. There's different tinctures and spray. There's bath bombs, there's roll-ons, there's all different, oops, sorry, I hit my computer. There's all different types of ways to start. So you can be a little bit more liberal with the application of topicals and non-ingestible forms, but for the ingestible form, it's usually recommended to start at 1 milligram and titrate 1 milligram per day until you find the dose that gives you relief.
Good. No, I think that those are all good answers. So with that, I am going to say thank you so much for being with us. I really appreciate it.
Thank you.
The information was awesome. Again, find a doctor that is interested in the kind of healing modalities that you're interested in. You don't have to stick with one doctor if they're not right for you. Pass,
Totally.
go to the next and take care of yourself. Research. There's PubMed.org, CBD reports. You mentioned Healer. And do your research, bring that to the doctor. For me, I had to train my doctor on what CBD was. She didn't know. And she really took the time to research it, to understand it. And now is like, yes, this is exactly what most of my patients need. So that's really, we're in the conversation mode. And so use these classes to help you with that. Have a stunning rest of your day, night, morning.
Thank you.
Be good, everybody, and take care. Use your cannabis. Enjoy. Bye.